my name is Corinne and I'm a midwife, lactation consultant and tongue-tie practitioner at Princess Alexandra Hospital. I'm going to talk to you about bottle feeding. If you choose to bottle feed your baby, skin to skin is really encouraged, and it's as I said before, it's a wonderful thing to do for that first feed in particular as well. And you both get the benefits of that closeness and being calmed down. It keeps your baby warm and it regulates their heartbeat and breathing. We recommend that babies, if you're formula feeding, are fed by one or two people, but at the beginning it's really important if it's just the mum, if you can manage it, because that bonding is so important. So we teach responsive bottle feeding. So that means you're responding to your baby's needs. So it's really important that, again, we don't let our babies cry. But if I just demonstrate with my pretend baby, so we want you to hold your baby close. As I said, skin to skin if you can. You look into the baby's eyes, chat to the baby. They really want to hear your voice. And this is my formula. And I've got my baby semi-upright, held nice and close. So I'm gently I'm looking for the feeding cues, and then I'm gently going to let the baby take the teat. Never force the teat. And we teach something called paced bottle feeding. So it's where the baby controls the amount they take. To suck, swallow, breathe on a bottle is harder than suck, swallow, breathe on a breast. So really, if the same person is feeding that baby, they really get to know the baby's needs. So we have the bottle horizontal. Gone are the days where we do that. We have it like that, and you might have it up a tiny bit. And then you look at your baby and you're looking at the sucks, and the baby may need a break, may need several breaks in the feed. So when the sucks start to slow down, or the baby may have milk coming down the side of them, out of either side of their mouth, or sometimes the baby's hands go like that and their feet, and they're saying, stop, I need a rest. It's not about winding, it's about understanding, suck, swallow, breathe, the baby needs a break. But you will get to know your baby really, really well. So they don't have to finish the feed. Babies self-regulate if we allow them to. So like us, we don't eat the same amount each meal, and babies are the same unless you've got a baby that's on scheduled feeds because we're worried about the baby. So really that's all you do, and one bottle per feed, and that's it. And then lots of cuddling afterwards. It's just a lovely, lovely thing. So we quite often get asked in the hospital which milk a baby we should give, formula milk we should give to a baby. And I'm here to say to you, all the milks are very similar because it's the law. If there was something that was beneficial in formula milk, the government would make it so that it was the law. So you'll see lots of advertising, but it can be misleading. So what we say to parents is, they're all essentially the same. It doesn't matter as long as it's number one milk. So they need number one milk until 12 months, and then the baby needs full fat cow's milk. So you'll see in the supermarket, hungrier milk, number 2 milk, number 3 milk, colicky milk, and we don't need them. The Department of Health have been very clear on that. So just number one milk until 12 months, then full fat cow's milk. So we will give you on discharge from the Department of Health a guide to bottle feeding. You can also download this as well from the internet free, and it talks about everything that we've chatted about and also how to make up formula. I would urge you to follow it. We will also give you this from First Steps Nutrition. Now, First Steps Nutrition is the only place you can get independent information on formula milk that is free of bias from formula companies. It's a wonderful site, and this talks about responsive bottle feeding. So everything we've just chatted about, you will be given written information about as well. I'm going to talk to you about how you safely make up formula milk. Hospital admissions for up to 3 years of age are much higher for babies who are given formula milk because there's nothing in formula milk that protects against infection. So you use fresh tap water with a litre of water, and you boil the kettle and you wait between 10 and 30 minutes, and then when the water is 70 degrees, which will be within 10 and 30 minutes, you would pour the water into a sterilised bottle, however much you need, and you would follow the manufacturer's instructions. So if it was 30 mils, you just do it to 30 mils, and then you would open your powdered formula, and you get a scoop and you get a clean something like a knife, and you just do that and you would put it into the bottle. So you put the water in first, then the powdered formula milk. And remember, the powdered formula milk is not sterile. So it's really important that when you add the powder, that the water is 70 degrees. And we ask you, if you can, to make up 1 bottle at a time. You need to read the manufacturer's instructions about how long you can leave it out. The stuff that you make out is usually about 2 hours from the time that you've made the milk. If you have to make up the bottles many at a time, we prefer you not to, but if you have to, you make them up in the same way, and then you would put them at the back of your fridge. When you make up formula milk, it's really important that everything you use is sterilised. So before you start, wash your hands, have a clean surface, clean it all down. And then if you used a bottle, you would rinse it out under the tap. You can use some washing fairy liquid, something like that, and clean it out. And then you would sterilise it as per manufacturer's instructions. So if it was a water steriliser, with your tablets, you make sure everything is submerged, and it usually takes about 30 minutes to sterilise it. When you take things out of the sterilisers, and you would take it out like that, try not to touch this bit and this bit, and touch it as little as you can, and then do that. And it's really important that you are clean as you possibly can be, and then you would sterilise it again afterwards.